जंगल बुक प्रतिदिन दोपहर 1 बजे। बाहर से मंगाया खाना लेते समय कोविड-19 से सुरक्षा संबंधी बातें। दस्ताने पहनकर ही पैकेट को पकड़ें। पैकेट खोलने से पहले इसे अच्छी तरह सैनिटाइज करें। पैकेट से निकालकर खाना किसी साफ बर्तन में रखें। जहां पैकेट रखें उस जगह को भी सैनिटाइज करें। पैकेट को छूने के बाद अपने हाथों को कम से कम 20 सेकंड तक साबुन से जरूर धोएं। लॉकडाउन 2.0 कार्गो और आवश्यक सेवाओं को अनुमति। कार्गो सेवाएं हवाई, रेल, भूमि और समुद्री मार्गों द्वारा कार्गो, जिनमें राज्यीय और अंतर्राज्यीय शामिल हैं, का परिवहन। 2 ड्राइवरों और 1 सहायक के साथ ढुलाई के वाहनों को अनुमति, डिलीवरी या पिकअप के लिए खाली वाहन। आवश्यक सेवाएं आवश्यक सामानों की आपूर्ति श्रृंखला, जैसे कि विनिर्माण, थोक, खुदरा व्यापार, आवश्यक वस्तुओं के लिए दुकानें या गाड़ियां, बड़ी ईंट और मोर्टार भंडार, राजमार्ग पर ढाबों और ट्रकों के मरम्मत की दुकानें खुली रहेंगी। व्योमकेश बख्शी प्रतिदिन सुबह 11 बजे।
Track all the major national and international developments about the outbreak as we near the 40th day of the countrywide lockdown on May 3rd. Figures from the Health Ministry indicate positive outcomes of the immense efforts put in by the government and the people responding to the Prime Minister's call to fight the pandemic that has claimed thousands of lives worldwide. Over 23% of COVID-infected patients have recovered nationwide. The doubling rate continues to slow down and efforts are on in full swing to ensure adequate supply of masks and personal protective equipment. Prime Minister Modi continues to connect with world leaders, and we also take a closer look at how the states are faring. All that and more in this edition. Let's begin with the headlines. Union Health Minister Dr. Harshvardhan says no fresh COVID case in 80 districts over the last 7 days, while the doubling rate of infection has reduced to 10.9 days in last 2 days. Health Minister says manufacturing of PPE kits has started in the country, says scientists and biotechnology experts engaged in developing vaccine and genetic sequencing for COVID-19. Active cases of coronavirus in India stand at 22,629 with 1,007 deaths reported from across the country. 7,695 patients cured and discharged. Prime Minister discusses COVID-19 pandemic with Indonesian President Joko Widodo and Canadian Prime Minister Justin Trudeau over the phone. Says close cooperation between India and these countries will be important in dealing with the challenges posed by the crisis. Global tally of confirmed COVID-19 cases goes past 31 lakh with over 2,17,000 deaths. United States worst hit by COVID-19 with over 58,000 fatalities, followed by Italy, Spain and France. Death toll in Brazil due to COVID-19 pandemic crosses 5,000. US President Donald Trump announces state of Texas will start reopening businesses in phases from coming Friday, says many states moving to reopen safely and quickly. And let's start by taking stock of the developments in India on ground zero. India is making progress in combating the coronavirus outbreak. The government is constantly monitoring all activities and making changes in rules and policies to ensure optimal use is made of available resources. Various union ministers held meetings on Tuesday to review functioning in their respective ministries. The Health Minister Dr. Harshvardhan reviewed the current status of COVID surveillance in Delhi with LG Delhi, Delhi Health Minister and other officials through video conferencing. Dr. Harshvardhan also held meetings with autonomous institutions and PSUs under the Department of Biotechnology through video conferencing. He briefed about the current situation of COVID-19 in the country and said no fresh case was reported in 80 districts since 7 days. 17 districts have not reported a case for last 28 days.
80 districts in India have not reported a fresh case since the last 7 days. 47 districts have not reported a case for the last 14 days. 39 districts have not reported a case for the last 21 days. And 17 districts have not reported a case for the last 28 days.
The Health Minister also highlighted a further decline in the doubling rate. For the past 14 days, the doubling rate was 8.7. For the past 7 days, it has been 10.2 days. In the last 3 days, it is 10.9 days.
So there is a doubling rate which is a very significant and powerful indicator of how the things are happening. So pre-lockdown, our doubling rate of cases was around 3 days. But when I talk to you today, for the last 14 days, our doubling rate had been 8.7. And for the last 7 days, it had been 10.2. And today, for the last 3 days, when we calculate, it is roughly 10.9. So I think that's a very, very significant progress.
He added that India will be able to produce RT-PCR and antibody test kits within the country by May. This will help India achieve the target of 1 lakh tests per day by 31st May.
मई के महीने में हम देश को अपने भारत में ही वैज्ञानिकों की सहायता से रिसर्च करके और RT-PCR की किट और इसी प्रकार से एंटीबॉडी टेस्ट की किट, ये दोनों चीज़ें जो है हम भारत के अंदर ही का प्रोडक्शन जो है करके और भारत की रिक्वायरमेंट्स को पूरा करने में काफ़ी हद तक मई के महीने में सक्षम होंगे। सब चीज़ें एडवांस्ड स्टेज में हैं। बहुत जल्दी ICMR की क्लियरेंस होते ही विद इन ए वीक वो सब चीज़ें प्रोडक्शन स्टेज में चली जाएंगी। जैसा कि हमारा टारगेट है कि 31 मई तक हम 1 लाख टेस्ट देश में करना चाहते हैं हर रोज़। उस टारगेट को अचीव करने में भी ये डेवलपमेंट हमें बहुत मदद करेगी।
And let's now take a look at the latest updated data provided by the Health Ministry as far as the distribution of coronavirus cases are concerned. Active cases in India stand at 22,629, with 1,007 deaths reported from across the country, while 7,695 patients have been cured and discharged. With this, India's recovery rate has climbed further to 23.3%, with more and more patients recovering. And well, let's now take a look at the COVID-19 cases in major Indian states. Looking at the map here, first of all, Maharashtra, of course, accounts for the highest number of cases at 9,318, active cases 7,530, those recovered 1,388, and fatalities numbering at 400. Coming next to Gujarat, another state with a high number of cases, confirmed 3,744, active cases 3,129, number of recovered cases 434, and deceased 181. Next, we come to Delhi. Number of confirmed cases 3,314. Number of active cases 2,182. Number of recovered 1,078 and deceased 54. Well, Madhya Pradesh is next in line with a number of confirmed cases at 2,387, active cases 1,890, and recovered cases 377, and number of deceased 120. And we're showing you the states on the map as well. Next, we come to Rajasthan. And Rajasthan, the number of confirmed cases 2,364, active cases 1,545, those recovered 768, and deceased 51. And next, moving on to Tamil Nadu. Number of confirmed cases still high, above 2,000, 2,058, active cases 865, 1,168 have recovered, and the fatalities are at 25 in Tamil Nadu. Next state, Uttar Pradesh, 2,053 confirmed cases, 1,557 active cases, number of recovered 462, and those deceased 34. And Andhra Pradesh is next, 1,259 confirmed cases, number of active cases 970, recovered 258, and those deceased 31. And in Telangana, we have 1,004 confirmed cases, active cases stand at 657, those recovered 321, and deceased 26. In West Bengal, there are 725 confirmed cases, active cases are 584, 119 recovered cases, and 22 deceased. We are taking a look at, in their order, the 10 states with the highest number of cases. Well, here we have the confirmed cases. We are showing you the bar by which we've marked them on the map here. As you can see, the maximum number of cases are marked in dark and then lighter and lighter shades. But this is the statewide distribution of corona cases in India. And well, 3 northeastern states, Manipur and Tripura, have no active cases right now. And the total number of positive cases the total number of positive cases in Assam stand at 38. However, with the discharge of 27 patients, the total positive cases in Assam is only 10. While 1 person has died, the recovery rates in Assam so far are 77%, which is quite good. The state cabinet yesterday took several steps to strictly enforce lockdown while also allowing rural activities. Here's a ground report from the state.
In a state cabinet meeting held on Monday, it was decided that the 5 red zone districts will be enforced with complete lockdown, and those green zone and orange zone districts, in those areas, the rural areas can open the shops but not markets. Those people stranded due to lockdown in various districts have able to come to their own districts, and around 30,000 people applied for the e-passes, and they have returned to their own districts as on Tuesday. The Chief Secretary of Assam have strictly mentioned that those traveling without e-valid passes will be directly put under quarantine. Chief Minister Sarbananda Sonowal and Health Minister Dr. Himanta Biswa Sharma, they have been constantly monitoring the whole COVID-19 situation in Assam. With camera person Rishu Singh, this is Reena reporting for DD News.
And in their outreach to provide everyone with basic essentials in the Union Territory of Ladakh, Lieutenant Governor R.K. Mathur launched a campaign of distributing masks to all Antyodaya beneficiaries and migrant laborers in Leh. The Lieutenant Governor handed over 2 reusable cotton masks to Antyodaya beneficiaries and migrant laborers from Doda district working in Ladakh, and over 30,000 Antyodaya beneficiaries and 14,000 migrant laborers working in Ladakh will be provided with the masks from the LG Relief Fund. While distributing the masks, the LG said that this is in response to Prime Minister Narendra Modi's call to wear masks as precautionary measure to stop the spread of novel coronavirus. The Union Territory administration has also decided to provide financial assistance of 10,000 rupees from LG Fund to 5 needy patients undergoing treatment outside Ladakh. Prime Minister Narendra Modi spoke on the phone yesterday with President of Indonesia Joko Widodo. The two leaders exchanged thoughts about the spread of COVID-19 in the region and the world. The Indonesian president appreciated the facilitation provided by the government of India for supplies of pharmaceutical products to Indonesia. Prime Minister assured him that India would do its best to prevent disruption in supplies of medical products or other commodities traded between the two countries. The leaders discussed issues related to their citizens present in each other's countries and agreed that their teams would remain in touch to ensure all possible facilitation in this regard. The Prime Minister underlined the fact that Indonesia is an important maritime partner in India's extended neighborhood, and the strength of the bilateral relationship would help both countries in fighting the effects of the pandemic. He also conveyed greetings for the holy month of Ramadan to President Widodo and to the friendly people of Indonesia. And Prime Minister also exchanged thoughts with Canadian Prime Minister Justin Trudeau. In a tweet, PM Modi said, I quote, had a warm exchange with PM Justin Trudeau, thanked him for looking after Indian citizens in Canada in these difficult times. Collaboration and partnership between India and Canada is vital to fighting the pandemic, including through medical research and supply chain management. The Indian missions in the UAE will soon start e-registration to create a database for NRIs waiting to return. In their outreach to Indians in UAE, the Indian embassies of Abu Dhabi and Dubai are expected to start the e-registration process for the same amidst the unprecedented situation caused by the coronavirus pandemic. Diplomatic sources indicate that the mission is gearing up for this large-scale exercise to know the number of people who are desirous of returning to India. However, the final call for the evacuation flights will be taken by New Delhi. Now it's time for a fact check. We not only bust fake news, we also tell our viewers which news is found true after verification. And these days, there's a claim going out, doing the rounds on social media in particular, projecting to be from the Ministry of Labour and Employment. According to this, the ministry has requested all chief secretaries to advise employers of all establishments to not terminate or reduce wages of their employees amid the coronavirus pandemic. The claim, however, was found to be absolutely correct. And we now look at some updates that inspire hope and positivity in tackling coronavirus outbreak in these difficult times. In these strange times, as we take up new practices as precautions against the new coronavirus, people all over are coming up with new and innovative ways to cope. In response to Prime Minister Narendra Modi's call for the lockdown to ensure the welfare of all, Cheti Thirukonam village in Ariyalur district in Tamil Nadu has decided not to step outside the village limits, even for essentials. Instead, villagers have turned adversity into opportunity and returned to the barter system of old. The village is home to over 400 families who exchange agricultural produce cultivated on their farms with each other. Farmers do not take their goods to the markets to sell outside. They just exchange it for articles they need. So far, it is serving them well. And in another good news story from Mizoram, people were seen saluting the Chennai ambulance driver who traveled more than 3,000 kilometers from Chennai to Aizawl. Raphael accompanied his friend Vivian's body when it was brought back in an ambulance after the latter passed away in Chennai. Social media group of Mission Veng locality in Aizawl expressed their gratitude by gifting Raphael the traditional taulho, puan and cash worth 21,700 rupees. They also honored the two Chennai drivers with the Mizo traditional Uttariya Diyar and gifted 5,000 rupees to each of them. Well, the number of COVID-19 cases is on the rise in Pune in Maharashtra even after the high alert. In such a situation, the Sardar Vallabhbhai Patel Hospital of Pune Cantonment Board has undertaken the help of someone who not only is serving patients suffering from COVID-19 but also providing relief to the staff. It is a robot. We tell you more in this story.
As the number of coronavirus cases in Maharashtra is on the rise, hospitals are coming up with innovative ways to assist patient and staff. In order to reduce the exposure between the patient and staff, the ITI department of the Pune Cantonment Board have developed an indigenous low-cost robot. Sardar Vallabhbhai Patel Hospital have dedicated a special ward equipped with 100 beds for COVID-19 patients. There are around 70 COVID-19 patients in the hospital. The robot has been tested successfully and is working in full potential in the special ward.
हम लोग काफ़ी प्रयास कर रहे थे काफ़ी समय से कि हम कोई हाई एंड रोबोट कुछ अदर स्टेट्स में जैसे कि राजस्थान में, केरला में और तमिलनाडु में है, लेकिन लॉकडाउन इश्यूज़ की वजह से उसका प्रोक्योरमेंट में बहुत दिक्कत आ रही थी। तो ऐसे में जो हमारे आईटीआई की टीम है और आईटीआई जो प्रिंसिपल हैं, इन्होंने उस समस्या को समझा और इन्होंने इस चैलेंज को स्वीकारा और इन्होंने इन हाउस उसको एक असेंबल करके एक रोबोट बनाने की कोशिश की, जिससे कि ज़्यादा से ज़्यादा पेशेंट्स को सर्विसेज दी जा सके बिना उनको एक्सपोज किए हुए जो हेल्थ वर्कर्स हमारे हैं।
The hospital staff thanked the ITI department for the robot. The robot has been developed for reducing the staff-patient exposure. The cost-effective robot has been developed with a total cost of only 45,000 rupees.
रोबोट रहने की वजह से नर्सिंग स्टाफ है और आया नर्सिंग ऑर्डिले है, उनका एक्सपोजर बहुत ज़्यादा कम हो रहा है क्योंकि पेशेंट को खाना देना, उसके बाद में उनको मेडिसिन दे देना, वहाँ तक जाना, उनको कुछ ज़रूरत है तो ज़रूरी चीज़ें वहाँ तक पहुँचाना, इसमें जो एक्सपोजर होता था वो बहुत काफ़ी कम हुआ है।
At a time when the centre and the state government are working day in and out to contain the spread of the virus, such an initiative not only boosts the morale of the staff but also brings in a ray of hope. With Shama Mishra in Pune, DD India.
And in Uttarakhand, amidst the nationwide lockdown, portals of the Kedarnath temple opened early this morning. The portals, however, are being opened strictly for performing only the rituals and not for devotees. The decorated shrine will, however, only host the chief priest of the temple along with a few others priests to accompany him. Darshan will not be allowed for devotees as of now due to the new coronavirus outbreak. The portals of the temple were opened at 6:10 a.m. today. Darshan for devotees, we reiterate, is not allowed in the temple as of now. And let's now scan through the developments from across the globe in World Wrap as far as COVID-19 is concerned. Speaking of reopening the economy, US President Donald Trump took to Twitter to inform that several states in the country are on their way to reopen, and that too safely. The US President said that Texas is ready to resume its working in phases from the 1st of May. He also referred to Texas Governor Greg Abbott's plan of three-phased opening of the states. Restaurants, retailers, movie theaters and malls in state will be open to the public till their 25% capacity to allow the practice of social distancing. The stay-at-home order in Texas will expire on April 30th, but bars, salons, gyms will still remain closed. Meanwhile, President Trump said the US was considering having passengers on international flights from coronavirus hotspots be tested for the virus. Meanwhile, the US has reached yet another troubling milestone as confirmed coronavirus cases topped 1 million on Tuesday. According to the Johns Hopkins University, over 58,356 fatalities due to the disease have been reported. The total number of people recovered stands at 1,15,572. And the U.S. Air Force's elite flying squad, the Thunderbirds, and the Navy's Blue Angels flew over New York and New Jersey to thank first responders, military personnel, and essential workers who have been on the front lines of the novel coronavirus pandemic fight. The flying demonstration squadrons made a formation of 6 F-16C-D Fighting Falcon and 6 F-18C-D Hornet aircraft for the 40-minute flyover. And more international news on the coronavirus death toll figures. In Brazil, they have crossed the 5,000 mark. The health ministry of the country confirmed. It has now surpassed China. Brazil is the worst hit South American nation due to the COVID-19 pandemic. The number of total cases is around 72,000. Experts believe the overall number of COVID-19 cases could be 12 to 15 times higher due to a large number of undetected cases given the lack of testing availability across the country's 210 million population. Meanwhile, another crisis has hit the Latin American country as people are discontented with President Jair Bolsonaro's handling of the epidemic. Many believe that he should resign. And in the UK, the death toll due to the virus has touched 21,678. UK has the 5th highest death toll in the world. The total number of infected cases is over 1,60,000. Health Minister Matt Hancock on Tuesday said that in view of the current situation, there is no short-term end in sight for the lockdown. Hancock added that the UK was one of the leading countries in the race to find drugs able to combat the symptoms of the virus, and a new phase of clinical trials involving one possible treatment had begun on Tuesday. He added that the death and infection rate was not low enough to contemplate reopening of schools. Meanwhile, hospitals, train stations and fire brigades fell silent across the UK on Tuesday as a tribute to the National Health Service and other key workers who have died from COVID-19. 98 health and care service workers in the UK are known to have died after testing positive for the virus. And well, that's all we have for you in this edition of Tracking COVID-19. Once again, a gentle reminder to continue to stay at home, to stay safe, and to observe the guidelines of the lockdown as a precaution against the deadly COVID-19. Thanks for watching. Namaskar.
डीडी फ्री डिश, भारत की एकमात्र फ्री डीटीएच सर्विस। अब देखिए आपके अपने पसंदीदा चैनल डीडी न्यूज चैनल नंबर 1 पर, डीडी नेशनल चैनल नंबर 2 पर, डीडी भारती चैनल नंबर 60 पर और डीडी इंडिया चैनल नंबर 84 पर। डीडी फ्री डिश, मनोरंजन का संसार सीधे आपके द्वार।
एक चीज़ समझने की ज़रूरत है कि ये जो आपका कोरोना वायरस है, ये ड्रॉपलेट इन्फेक्शन है और ज़्यादा दूर तक नहीं जाता है। पेशेंट अगर खांसता है, छींकता है तो ये 6 फीट से पहले नीचे अपने वेट के हिसाब से नीचे गिर जाता है। पब्लिक को मैं यही मैसेज दूंगा कि सोशल डिस्टेंसिंग, hand washing and use of sanitizer, not to touch your mouth, nose, face.
कल रात क्या राजकुमार बाबू अपने कमरे में थे?
जी थे। रात 8:45 मैंने खुद अपने हाथों से उन्हें डिनर दिया था।
अच्छा। राजकुमार बाबू, कल रात मेन गेट कितने बजे बंद हुआ था?
आप 11 बजे आए, उसी के बाद मैंने दरवाजा बंद कर दिया।
आवाज क्यों नहीं देते? राजकुमार बाबू,
क्या हुआ?